Well, good evening. Going to call the Health Board meeting to order. So we'll begin with the Pledge of Allegiance.
I pledge allegiance
Allegiance
to
to
the
the
flag
flag
of the
of the
United
United States of America
and
and
to
to
the
the
republic
republic
for which it stands,
one
one
nation,
nation, under
under
God,
God,
indivisible,
indivisible,
with
with
liberty
liberty and justice for all.
for all. Okay. Um, any public comments? So
There are currently no members of the public in attendance.
there are? Oh, there
There
are
are
no.
there are not.
Okay. Sue, have you had any comments from the public?
No, I have not.
Okay. So then would you like to give us a review of the minutes of December 4th?
Sure. So last time we met was before the holiday. Basically, we talked about the appointment of making me the acting director in the interim while we went through the search process. We had Tom McCarthy, the HR director for the town, appear at our meeting, and he gave the board sort of an overview of the upcoming search process for the director of health, sort of kind of the steps that we needed to take, put a committee together, meet with the applicants, and then kind of proceed, take our requests, send them to Vicky, and then work from there. So we can give you more information on that when we go into executive session, if anybody has any questions, but until then we will hold off. And then we just talked about some of the updates that were going on with the health department. So we had Lucy had recently left. We had an Aquarian letter that was sent out regarding lead in the water supply. There were some high levels, so we made sure we got all that information out to the public. We talked about our flu clinics, our teen advisory group, and we will give you some more information on all of that for our December and January report.
So do you want to go into the January report now? Or does anyone have any questions about December's?
I think we need to approve the minutes, Deb.
Oh, that's right. So can I have a what's it called again?
A motion?
A motion, got it, to accept the December minutes.
Make a motion to accept the December minutes.
Okay. And can I have a second?
I'll second.
Thank you. Okay. So Sue, should we go on to January?
Yes, so I'll give you a review of what's been happening at the health department over the months of December and January. There'll be no surprise. We have seen an increase in flu cases in our residents as well as throughout the state and the country. It is definitely on the rise. It's a tough year this year for flu. We have about 10 doses of flu vaccine left, so still a couple of doses if anybody needs it. We placed our flu vaccine order for the 2025-2026 flu season. We ordered about 650 doses, and then we will also order about 200 doses for our vaccine for children. It's about 100 doses fewer than what we had last year, and we're basing this off of we did fewer doses this year, and we've done fewer doses in the past 3 years, so we just thought it was best to decrease it. We could always order more should we need it. We also are not sure what's going to happen with the over-the-counter nasal spray. So we didn't want to get caught having too much vaccine and not being able to get rid of it. So we're just kind of keeping track of that and see what happens over the next couple of months. But we do have to place our order really early so we make the best projection that we can. And again, we can order more if we see that we might need more come September. We continue to monitor what's happening in the country with H5N1, which is avian flu. DPH continues to send us updates on any new information that they receive. On Monday, we sent a letter from the health department, as well as some guidance to our superintendent, our selectmen, our parks and rec director, police, and our emergency management director. And basically was just alerting them that, H5N1 has been identified in Connecticut in New Haven County. And we just want them to keep an eye out for any dead birds that they might find on town property, on school grounds, and just gave them some guidance for people who might come in contact with that, how they can protect themselves from getting infected, and the appropriate state agencies to call should that happen. Hopefully it doesn't happen, but again, we want to make sure everybody is aware of what's happening and just to be on the lookout. Since January 1st, the state statutes for lead levels has decreased, so we're starting to see an increase in childhood lead blood poisoning. The numbers went from 15 and dropped down to 5. So anybody that is a blood level of 5 or higher, we need to do an epi investigation, which means our sanitarian and our public health nurse, they go out, they look at the home, they talk to the family, they look at the food that they're eating, they test their toys, the windowsills. So it's a whole process. Last year, we had 7 cases that we had to do this for. This year, we're only into the beginning of February. We have had 3 cases and we just got another one, 4th. Again, these are very low levels, but because they changed the level so drastically down to 5, we are now starting to see some cases. So we are on top of that, and we go out as soon as we get those to make sure we can rectify the situation before it's too late. So that will keep us busy, I think, for the next few months anyway. Our public health nurse has been working closely with DPH and one of our other local health departments in the state on a TB case. We do have a patient that has been in the hospital for some time, hoping that she can get discharged soon. And the reason why we're working on this with the other health department is we're unsure where this patient will be going once she is discharged from the hospital. She may be staying with a daughter in Trumbull or a daughter in another town. So we're trying to work together so we all have the same information so that we can do what's best for this patient and get her discharged. Allison, do you have a question before I go on?
I did. It was back on the lead cases.
Yes.
Are you guys, where are you getting the cases from? Are you seeing this reported out from pediatrician's office on like routine annual well visits or?
Yeah. So
Okay.
they have blood work done and
Yeah.
it goes to the state lab and the state
Okay.
lab notifies us or the physician's office will notify us and then we follow up.
Okay. Thank you.
You're welcome. So we're working on that TB case. We'll see what happens there. We have been given Narcan kits from TPOD so that we can offer Narcan training. If people come into our office, we can do it right then and there on the spot rather than telling them they have to wait for the next community session. We've been working closely with TPOD over the past year or two doing Narcan training, and we just thought this was a great opportunity. If we can have it in our office over the holidays, we had people come in, their kids were home for college, they wanted to be trained. So this gives us the opportunity to offer this as people come in on an as-need basis. So we're kind of happy to be able to do that.
That's great.
We provided a bloodborne pathogen training to our employees. In December, we do this annually, so we make sure everybody is aware of the risk and how to prevent that. We recently met with Parks and Recreation to discuss some partnership activities that we can do with them for this coming year. We plan to work closely with them on some events like their Easter egg hunt, their triathlon, and to assist with coordination of volunteers using our tag team. So we're trying to work closely with our partners, share our resources, and just really get out there and be a presence in the community. We assisted Sustainable Trumbull with the used toy drive, recycling drive. We were a collection site at the health department and we were not really sure how many toys we were going to get. And we had Lucy's entire office filled, and I mean filled. It was incredible. In 1 week, we got so many toys and we were able to distribute those to some organizations that needed them more in the Valley area, because after all that flooding that we had in the fall, a lot of agencies had lost toys, their families had lost, their belongings. So we were able to give them some really nice used toys. So that was a nice partnership that we developed with Sustainable Trumbull. Our tag team volunteers, who's our teen advisory group, they recently just went to the senior center and decorated the the lunchroom for Valentine's Day, so gave the seniors a little treat. They also made some cards to give to the seniors. And we had a student who did a toiletry drive at school, so we are going to give all those supplies to the food pantry so that they have some toiletries that they can hand out as well. During December, our sanitarians conducted 22 food inspections and we had 3 re-inspections. And in January, they did 26 food inspections and 2 re-inspections. So we are on top of our restaurant inspections. We continue to move forward and keep busy with that. In January, we offered A1C testing to our town employees. We had 18 employees participate, so that was something nice that we were able to do. We were able to purchase the kits through a grant that we received, so we're happy to do that. We're also going to be doing that for our residents in the month of February. We participated in the Tashua Elementary School Mental Health Awareness Night. They do this program that they started 2 years ago where they have families, Tashua Elementary School families come with their kids and they do different activities and really just to promote the importance of good mental health, nutrition, exercise, a diet. So we do fun activities like cornhole with them and teaching them about eating healthy and the food groups and the importance of, talking to someone when you're feeling sad. It's been very successful, so we're happy to participate in that. We've been distributing radon test kits as well to our residents. January is Radon Awareness Month, so we try to get those out to our residents. And then finally, we were able to purchase and distribute flu COVID test kits this holiday season, again through a grant. We are all out of them. We didn't get rid of them over the holiday like we thought, but everybody came in right after the holiday to get their flu and COVID tests. So we are out of those, but we're happy to be able to provide that as a service to our residents.
Wow, busy, busy, busy.
Sorry, that was 2 months worth. I apologize for talking so much.
No, it's nice to hear these things. Yeah, wow. Okay, so do I have a motion to accept the January minutes?
I motion.
Okay, Karen, thank you.
We
And
haven't
do I
done
have-
the January minutes.
We didn't? That was
No.
all just December?
That was December and January. Taylor's going to write them up for us, though.
Oh, okay. Oh, I see. I'm looking at the minutes of December 4th. I'm
Yeah,
sorry.
that's okay.
Well, thank you, Karen, anyway. Okay, is there any old business anyone would like to bring up? Any new business? Well, I'm just gonna mention something. I think you probably received from Taylor the request about the dinner next Thursday night at Tashua. Are you planning on going? Karen, you?
I am not going to be able to make it this year.
You're muted.
Carrie, you're muted.
Oh, sorry, I'm not going to be able to go this year. I did just respond to Taylor. Unfortunately, I won't be able to make it.
Oh, okay. So, all right. And,
I also can't make it. I have a
okay.
previous commitment.
Okay. All righty. I think that's it then. From what I see, Sue, are you, is there anything else that you want to go over?
That's all that I had.
Okay.
Does anybody have any questions for me?
You're doing a great job filling in.
Oh, thank you.
Yes,
We have-
definitely.
We have a good staff, so it's easy to do that.
Okay, so then I can adjourn the meeting?
Yes.
All right. Okay. Meeting is adjourned. Thank you.
Thank you.
So before everybody hangs
I have
up,
to make a motion.
Oh, I'm sorry.
Yeah, you have to make a motion to adjourn the meeting.
Okay. Told you I'm not going to.
That's all right, Deb. We got you.
Can I have a motion to adjourn the meeting?
I'll make a motion to adjourn the meeting.
Thank you. Okay, and do I have a second?
I'll second it.
Thank you. All righty. Sue, did you want to say something?
yeah, I was just, Oh, I was just gonna say, before everybody hangs up, Bill has just sent everybody a link. If you wanted to go into executive session, if you had any questions about the Director of Health search process, I'm happy to talk to you on that secure link. If you don't have any questions, or if you just want me to follow up with you tomorrow with a quick little email as to the status of where we are, I'm happy to do that as well. So,
I'm
just
with
let
this.
me know if we could click over, that's fine.
I'd be fine with like an email update unless you need our input or anything that we can help you with for the search.
Okay, I can easily send you an email.
Sounds great.
Okay, then I will do that as soon as we hang up. Bill, thank you for setting up the other portal. But we don't need that tonight. I'm just gonna let
Yeah.
everybody know kind of where we are and kind of what the next steps look like they're going to be.
Sounds good.
And next meeting is going to be in person, correct? Next
Correct.
month's meeting? Okay,
Yes.
perfect.
Yeah.
Awesome, thank you.
Hopefully the
Great.
weather cooperates and we don't have snow, right?
Right.
Going into March.
Mm.
But enjoy it while we have it.
Yes.